We were fortunate enough to go to several fantastic locations and be able to spend a lot of time with some really amazing surgeons. I really just wanted to find ways to improve what I do in the OR and then also hopefully expand some of my indications for revisions.
I was very intrigued by this option to try to watch these guys make everything look easy, because I found that I can make any case look hard.
It was a 2-week fellowship, and it was all sponsored. You can see the sponsors listed there, so we want to thank them, of course, for allowing us this opportunity. And then, of course, here's our list of surgeons. My goal out of this fellowship was to actually see if these guys were as good as they were in their videos.
I started doing some revisions, dipping my toes into femoral-sided work, and just wanted to learn from some of the absolute best surgeons in the country. And the AHF offered a very efficient traveling fellowship to be able to do exactly that.
We learned lots of tips and tricks on how to approach revisions from an anterior approach, and then also how to do more complex primaries or even conversions with retained hardware and things like that. It was a real whirlwind, but it was an awesome experience. They also put on this excellent cadaver lab for us where Dr. Cooper demonstrated his talents as an anatomist and his ability to do very extensile exposures on the acetabulum very cleanly and very quickly. Our second day in the OR there, Dr. Cooper managed to find a Vancouver B2 periprosthetic fracture for us to revise. And then they also arranged for Dr. Jose Rodriguez to come over from HSS and do a little visiting professorship
At Anderson Clinic with Dr. Sershan, I learned that you can do 50-plus BMI patients from an anterior approach, something that I plan to use on my return to North Carolina. We also saw a complex revision arthroplasty that he made look pretty easy. So here's us in front of the White House. This is our Porsche driving experience in the middle here.
A day with Dr. Saar in the hospital setting, and coming from the UK, it was quite the experience seeing him moving seamlessly from OR to OR, operation to operation, with a team working around him who were working like a Formula One team.
We were able to spend time with the Godfather himself, and it's truly an honor to watch the master at work.
And so next we were off to Atlanta, where we'd all heard about Dr. DeCook and his efficiency, and we've all read and know of the paper of 12 by 12, but I think this was inaccurate because we actually saw 16 joints by 11 a.m.
And final stop in Louisville, Kentucky, with Dr. Urasimides, who was the most phenomenal of hosts. He truly is one of the most gifted surgeons, and it was a real privilege to see him at work and learn from him. Going over the 2 weeks by numbers, we visited 5 sites. We saw approximately 40 or so anterior total hips, at least 5 steak dinners. Finally, we feel that the AHF is a family of surgical and process innovators and disruptors. So we came with an open mind, and we truly were amazed.
Well, thank you to our fellows. As you can see, we had 6 incredible fellows, and at least from the host perspective, we were very impressed by how talented they are, how inquisitive, how energetic they were for the fellowship, and we feel very confident that the AHF will be in great hands moving forward.